Good afternoon. Welcome to our Lunch and Learn series. I'm Dr. Lauren Williams. I'm a primary care doctor in Fort Washington with the MedStar Medical Group. Today we're going to be talking about ticks and Lyme disease. A little bit about myself is that I did my undergraduate education at Howard University. I did my medical education at University of Virginia and completed my residency at University of Illinois at Chicago for internal medicine and pediatrics. And I've been in MedStar for 5 years. So getting to our topic today, which is very timely as we're heading toward the summer season where everybody's out and about and being more exposed to bugs in general. Particularly, we're going to talk about tick and tick exposures today. So in terms of ticks, there are over 800 different species throughout the world. And here in the United States, we have about 90 different species. Generally, ticks tend to group themselves in particular geographic regions, so your exposures are limited to where you actually are. They like to be in fields and in wooded areas, and in nature, they typically serve as food for other animals, and they in turn like to feed on the blood of mammals. Luckily for us, only a handful of these species actually cause illness in humans. Within the United States, there are a few common species: the Lone Star tick, the American dog tick, the brown dog tick, the Rocky Mountain wood tick, the blackleg tick, and its corresponding on the Pacific coast, western blackleg tick. This table just goes through this a little bit more in detail about where these ticks are found and also the diseases that can be associated with them. The black-legged and the western black-legged tick I'll talk about more in detail when we get to Lyme. The American dog tick is usually found east of the Rocky Mountains and a little bit on the Pacific coast, and it's associated with Rocky Mountain spotted fever as well as tularemia. The Lone Star tick is found in the southern region of the United States, and it's associated with southern tick-associated rash illness. Just a heads up that these names are not very creative. There's also Rocky Mountain wood tick, which of course is associated with Rocky Mountain spotted fever, and surprise, is found in the Rocky Mountains in the western part of our country. As I mentioned, the focus of this talk is going to be primarily on Lyme disease. Lyme disease is the most common tick-borne illness here in the United States. There are about 30,000 cases that are reported by the Center for Disease Control yearly. There is some concern that in terms of the reports, that they're underreported and that there are actually more cases than are actually being captured. 95% of the cases come from a group of 14 states. And in our region, Maryland and Virginia are part of that group. This picture here shows the culprit for Lyme disease, and that's the blackleg tick, which carries the bacteria Borrelia burgdorferi. As I mentioned previously, the blackleg tick is the culprit, typically found in the northeastern region of the country, also in the mid-Atlantic, the north central, and the Pacific West Coast is where the western blackleg tick resides. This picture looks at the life cycle of the blackleg tick. It begins as a larva, it grows into a nymph state, and finally into the adult tick. As you can see, it's very small, and you can see it in comparison to the size of a dime. In terms of the transmission of Lyme, the nymph stage tends to be more significant. Because the adults are larger, they tend to be found more easily. And the nymphs are able to stay on the body longer because of their smaller size. In order for the infection to be transmitted, the ticks actually have to take a blood meal from the person that they're infecting. This can take at least 24 hours after attachment for this to occur. So if a tick is found on the body, but is not attached and is easy to remove, then it's less likely to transfer infection. Also, if the tick is still flat and tiny but attached, then it's less likely to cause infection because it has not yet had a blood meal. This is a picture, once again, of the life cycle of the tick but now showing the adult ticks after a blood meal. And you can see that it's significantly larger than the adult tick that hasn't taken a blood meal. In terms of our symptoms, they're divided into two different sets, one being early stage symptoms and the other being late stage symptoms. The early symptoms typically occur 3 days to a month after a tick bite. The most characteristic symptom is the bullseye rash, which is called erythema migrans. And as you can see here, it looks just like it sounds, a bullseye. It has a red center, has some clearing around it, and then another red circle around it. This occurs in about 70 to 80% of all people that are diagnosed with the infection, but it doesn't occur in all. The other symptoms are more like flu-like symptoms: fevers, chills, fatigue, muscle aches. For the late symptoms, which once again occur days to months after the tick bite, this is also what we call widespread or disseminated Lyme. And just like it sounds, it affects other parts of the body. So it can cause joint pain, it can cause Bell's palsy because it causes paralysis of the facial muscles. It can cause heart palpitations because the bacteria affects the heart. And it can also cause nerve pain, as well as a meningitis as it affects the lining of the brain. In terms of the diagnosis, the signs and symptoms are consistent with Lyme, as well as if you have a history of being exposed to an possibly infected blackleg tick, should take you to the doctor. At that point, a history and physical will be performed and possibly blood tests as well. The blood tests that are conducted for Lyme are what we call indirect tests. They look for antibodies to the bacteria as opposed to looking specifically for the bacteria. But that's the way that it's been determined to be best to find out whether or not someone has had Lyme. Once a diagnosis is made, antibiotics are prescribed. Typically, they're given for at least 10 days and can be up to 21 days for early Lyme. Late Lyme typically has a much longer duration of antibodies. Now the controversy. We hear a lot in the media about chronic Lyme. We hear a lot about people having symptoms that are later attributed to Lyme. In the medical community, we actually have fallen out of favor with the term chronic Lyme. And we are now using post-treatment Lyme disease syndrome to describe where the symptoms don't completely resolve after treatment, and we still have nonspecific things such as joint pain and fatigue that persist after treatment. There is no universal definition, but it is central that there is a diagnosis of Lyme and that there is treatment in order for it to be post-treatment Lyme disease syndrome. Otherwise, symptoms that don't correlate with a diagnosis of Lyme should be investigated further for other causes. We've talked about the diagnosis, we talked about the treatment, and we've also talked about the post-Lyme treatment syndrome. Now we're going to talk about how to prevent this altogether. First and foremost, being mindful when you're out and about. Going to be in wooded areas, going to be in fielded areas. The first thing is clothing, to make certain that we're wearing clothes that make sense. Wearing long sleeves, wearing long pants if you're going to be exposed to potential insects or arachnids like ticks. The other part is wearing insect repellents. DEET is the most common active ingredient in our insect repellents, and so that's what's recommended for prevention against tick bites and tick diseases. The other option are wearing clothes that are treated with a pesticide, such as permethrin. Once you've been outside and you come in, of course, checking for ticks daily. Being mindful that ticks like warm, moist areas, that includes the armpits, that includes the groin, that includes the hair, and doing a good once-over to make certain that every area has kind of been inspected, particularly looking out for those nymphs, those smaller ticks, because they can burrow in those hidden places. Another option is to place your clothes in the dryer for at least 10 minutes after coming indoors to kill any ticks that may be on the clothes. In the event that you do have a tick bite and you find one attached, the best way to prevent getting Lyme is to remove the tick as quick as possible. My understanding is that the live audience cannot see the images, so they will be uploaded later. But there is a picture here to show how to remove a tick. And so the procedure is to take fine-tipped tweezers and to place it at the base as close to where the tick has attached as possible, and to lift straight up to remove the tick. After the tick has been removed, you cleanse the area with soap and water or rubbing alcohol. There are a lot of other theories out there about smothering the tick and using petroleum jelly and other kind of things to remove the tick, but those are not advised. So that is the end of my formal presentation. I'm going to open up for questions. All right, first question. Rachel wants to know, how do I avoid getting Lyme disease? And so we touched on that a little bit in the presentation. First and foremost is being mindful when you're going to be out in the woods and going to be exposed to possibly tick-laden areas. Once again, being mindful of the clothes that you wear, wearing insect repellent, and checking for ticks daily. Next question. Sherry wants to know, what's the best way to check for ticks on yourself or loved ones? Once again, doing the once-over, looking particularly in kind of the folds and in the warm, moist areas to make certain that there aren't any ticks that are hidden there. And if they are there, once again, going through the procedure of removing the ticks with the tweezers. Another question from Ms. Shirley. Why my cardiologist wants to do a Lyme test on me when I went into heart block? Well, as I talked about earlier in the presentation, for later symptoms of Lyme, it certainly can affect the heart. And when the heart is affected, that can also affect the heart rhythm, which is what heart block is. It's an abnormal rhythm where the electricity in the heart is not conducting the way that it should. And a thorough cardiologist would run a panel of tests to make certain that there isn't an infectious component. And one of those may be Lyme, because that's a potential way that we could treat the heart block for good. That would be why. Another question from Sean. Why is diagnosis of Lyme so difficult? My cousin went to 3 different doctors before one would test him for Lyme and get an official diagnosis. The tough part is like I mentioned, the testing for Lyme is an indirect test, which means that you have to have the antibodies in order for it to be confirmed. And sometimes those antibodies can take days to weeks to show up. You also have to really kind of have a suspicion for it. So if the history didn't suggest that there were ticks involved, or the history doesn't suggest that there was an exposure, then that may be why it took a couple of tries in order to get to that diagnosis. Taylor asks, I've heard there are co-infections included with Lyme disease. What do those include? Great question. So of course these are tick-borne illnesses, which means that other illnesses that ticks carry can also be associated with them. And you will see when it's uploaded the table that shows that the same ticks that carry Lyme also carry the diseases for babiosis and anaplasmosis. And so these other tick-borne illnesses can sometimes go along with Lyme. Michael asks, how common are false positive diagnoses? Great question. So once again, we are dealing with a 2-step process in terms of the testing. The blood test, first and foremost, tries to make certain that they are catching all potential people who have Lyme. And then there's a secondary test that goes through to make certain that they're catching all of the actual people with Lyme disease. So we have about a 10% false positive rate. Kayleen asks, I have a mild arrhythmia. Could that have been Lyme that I had years ago? It is a possibility, but once again, it has to be in the right context. So if there are a history of tick bites, if there are a history of tick bites in a location where Lyme is prevalent, then this is a possibility. If you remember being bitten by a tick, then I would definitely mention that to your physician so that you can be properly tested for it. Kayleen also asks, I have the alpha-gal syndrome. My level is 19. How dangerous are pills and gelatin capsules to me? Is the effect cumulative if I took them regularly? My original attack was whole body hives and a tightening throat. I'm going to ask Ms. Kayleen to clarify. What level is she referring to? And what kind of gelatin capsules? I would actually defer that question to her actual provider. It's a little bit too specific for me to give a general answer for, so I apologize, Ms. Kayleen. Other questions? Ms. Tina, my father has Lyme disease and the recovery period has been very slow. He's on a cocktail of antibiotics and vitamins and has been for 2 years now. He was diagnosed probably a year after first catching Lyme. Will he ever fully recover? Sorry to hear about your father, Ms. Tina. And this is a very complicated part of Lyme because once again, we've had this phrase known as chronic Lyme that we've had in the media and that we are now referring to as post-treatment Lyme disease syndrome. In terms of post-treatment Lyme disease syndrome, we honestly do not have a great answer as to why this happens to certain people. We also don't know how long that the symptoms will persist. So in terms of will he ever recover, I'm not certain. But it sounds as if he's getting the proper treatments, and it honestly is just kind of to see how well he does. As long as he's keeping in good contact with his physician and has good follow-up. For Ms. Leslie, what should you do first, and or what type of doctor should you go to if you suspect you have Lyme disease? What you should do first is contact your primary care doctor. Like I said, I'm a primary care doctor, and we get these questions all the time about tick exposures, also about possibility of Lyme. So if you have the right context where you've been bit, you think that the tick has been present for at least 24 hours, or if you are having any of the symptoms, flu-like symptoms, or have developed a bullseye rash, those would all be reasons to get to your primary care doctor. If you're unable to get to your primary care doctor in a timely fashion, we do have our MedStar prompt care as an alternative as well for you to be evaluated. With Lyme disease, the first line is typically the primary care. If the symptoms or if the treatments become a little bit more complicated, we do have our specialists, the infectious disease specialists, to help us out if we run into any difficulties or complications. From Michael, can you get Lyme if you never find a rash or tick? Isn't that the telltale sign of Lyme? Great question. So, yes, you can get Lyme, even if you don't recall a tick bite. And yes, if you never had the rash. As I mentioned earlier, that bullseye rash is characteristic, but is not for everybody. So 70 to 80% of people will actually have that rash, but the other percentage will not. So it really comes to having a high suspicion for it. If you're having symptoms that are not explained through another means, definitely mention it to your doctor so that you can be properly screened and treated if needed. Any other questions? Maybe I get a few more minutes to get the Q&A in. One coming in from Miss Karen. Are there any effects of long-term antibiotic use? That's a really good question as well. Actually, in Lyme, we are getting away from prolonged use of antibiotics. So typically with late symptoms, maybe up to a month of antibiotics, sometimes a couple of months, but years worth of antibiotics we're getting away from, because what we find is, once again, getting to that post-treatment Lyme disease syndrome, that prolonged courses of antibiotics do not make a difference in terms of outcome or in case of symptoms. So long-term use actually would not necessarily be warranted. So you should not have side effects. Ashley asks, can vitamins help treat Lyme disease? In terms of treatment, no. Vitamins may assist in terms of the rehabilitation, in terms of how you feel, but in terms of actually treating it, because it's a bacteria, antibiotics are the treatment for Lyme disease. Coming off the heels of that, sometimes the question comes, how do you know if you've been cured? And once again, that is a difficult question because The testing looks for antibodies, and antibodies persist in our systems for months to years. So if we were to come back and repeat testing for the antibodies, they would still be present, but the infectious component has been cleared. So most of the time we go off of the clinical picture that if you're getting better, then we know that we've done well with treating the infection. Tracy asks, is Lyme something that stays in your system forever? So I'm going to separate out the question. So in terms of Lyme itself, Lyme is caused by a bacteria that we can treat and that we can take care of. Lyme antibodies, which is what we test for, it is very possible that once your body has created those antibodies, that they last for quite a long time, so that as we continue to check for them, that they will persist. In terms of forever, I can't say, but it's very possible that it's for a very long time that the antibodies are in your system. All right, we got more questions rolling through. Michael asks, why is there so much false information online, and what's a reliable source? Why? It's because there are a lot of people who have suffered with conditions, and it may have been attributed to Lyme. I think there's a lot of a lack of trust sometimes with the medical field and with the medical community in terms of getting answers. And so people tend to find ways to make what they felt and what their experience has been make sense for them. And sometimes it's not the most accurate in terms of what the scientific community deems to be correct. So a reliable source would be the Centers for Disease Control, www.cdc.gov. Another reliable source is talk to your physician, talk to your doctor to ask if you have questions regarding your experience with ticks, your questions about Lyme, and other things about that. Kayleen asks, what antibiotics are most used to treat Lyme? I'm allergic to doxycycline. I love it. So actually, doxycycline is the antibiotic used to treat Lyme most commonly. In terms of alternative treatments, to be quite honest with you, I would defer to the infectious disease specialist because that is our first line of treatment. Other questions? I appreciate you watching. I appreciate the questions. As said, I'm a primary care doctor in Fort Washington. I can be found at 900 East Swan Creek Road in Fort Washington, and our number is 301-292-1590. I hope that you'll come back to our Lunch and Learn series monthly and continue to learn along with us as these topics arise. Have a great day.